Calgary-Shaw, followed by
Thank you, Mr. Speaker. We've heard the minister defend his decision to slam the doors of the Michener Centre shut, even saying that it was, and I quote, an unacceptable situation. Well, on that we can agree. It's unacceptable that this minister is kicking people out of their homes, and it's unacceptable that this minister feels helpless to do anything about it. The Michener Centre is also a support system for many patients that require stabilization before returning to community living, and losing this service will be a detriment to the social fabric of our province. Why is this government again targeting the front lines for cuts instead of the bloated bureaucracy?
Honourable Associate Minister for Disabilities.
Thank you, Mr. Speaker. Mr. Speaker, if the honourable member had been paying attention to the budget discussion, and if he attends the estimates, he'll learn a little bit more. We actually have made administrative cuts across the board. But, Mr. Speaker, the closure of the Michener Centre is about care for the vulnerable people that are in there, and it's going to improve. We've got a significant body of evidence that's been gathered across North America. We have our own evidence right here in Alberta, and we're making the right move for putting the patients first, Mr. Speaker.
Thank you, Honourable Minister. Honourable Member.
Given the hardworking staff at the Michener Centre not only provide a home to these vulnerable Albertans, but also provide a transitional facility for many individuals that have been stabilized, how can this government justify shutting down this essential frontline service while continuing to support managers, managing managers at all levels of government?
Easy thing to say, Mr. Speaker, across the board, where we've got so many managers and all this administrative overhead. The fact that it's not true doesn't seem to matter to that honourable member. Mr. Speaker, if the member knew anything about transition, then he would understand how inadequate this facility is for the transition of patients. That is one of the reasons that we're moving to a better model, Mr. Speaker.
Honourable Member, final supplemental.
Given that the Albertans who have been cared for at the Michener Centre are still going to require the care and support of the community, and given that the Michener Centre was a safe place for these Albertans and not a homeless shelter or a psych ward, are there going to be supports available for these individuals once they have been kicked out of their homes, or is this minister just going to make them fend for themselves?
Honourable Minister.
You know, Mr. Speaker, that is so ridiculous it almost doesn't deserve an answer. The opposition there would have Albertans believe that we're just going to turn up people out onto the street and put them on a waiting list for new homes. The facility doesn't even close until every single resident in there has got a care plan prepared and is moved into an appropriate setting. They're going to get all the supports they need and more, Mr. Speaker.